Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education, by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure and privilege to welcome Grace Detrevarah, LGBT Liaison and Health Educator at the Osborne Association, Wellness and Prevention Department, Bronx headquarters. Grace, welcome.
Welcome. Hi, everyone. Good morning.
So pleasure to have you with us today, Grace. Thank you so much. So, we live in complex times, so many challenges ahead, particularly to historically marginalized communities. You've been doing some incredibly important work in the LGBTQ community in the Bronx, in NYC, regionally and beyond. Tell us a little bit about your work.
The work that I do is basically about saving lives to save my own. I say that because it's such a broad thing of what I do. What I do is what's always been done, and that is letting communities, especially communities that are affected by HIV, incarceration, and anything about trans liberation. That is what I do. That's what I've been doing. My advocacy now is going on 10 years. In the last 5 of those years, what I've been doing is making the conversation very available, generalized, and realistic when it comes to the health, what's affecting those people of the LGBT community, when it comes to health, HIV, and all those things requiring us to live in this country as a marginalized community.
And so critically important work, it just seems like, and I am not an expert, but it seems like in the last 20 years, so much has changed and so much has remained the same. What do you see as, and this, I think this is a tough question, so feel free to revise it as needed. If you were to say one accomplishment that really was like, that helped, that was a good thing to help LGBT communities, and then what is the most important, or what is a key challenge that you're facing today in your work? So it's a 2-part question.
Well, first of all, let me just be clear. The work that I'm doing is not new, and the work that I do will continue and can always be important when we're talking about saving lives and basically giving avenues and pathways to those people who are affected with HIV or affected by the criminal justice system or something that's combined. What I can say is what has been proactively helpful is that everyone now wants and should be at the table. And when I say at the table, those the tables of decision making, when it comes to you researchers, that you stop chasing your tails with just the information of what you're getting statistically, that you allow people like me and you invite us and you make us, and when I say us people who are on the front lines, people like myself who deal with those people who are, soon as they're diagnosed, soon as they're released from prison or they're returning into society, that we are someone that you come to when those decisions of how you're going to treat, how you're going to regulate, how are you going to go to every state in which to bring policies that are going to help people, not just document information. This is about saving lives. I believe that is what has changed, because I believe, being a person who has been affected by the criminal justice system, as well as being a person who lives with HIV since 1988, that we've seen the ups and downs like any ailment would have. But when it comes to this disease, and particularly HIV, it has always been an uphill battle of getting the information to those who it really affects. I believe that researchers and policymakers, they mean well. They do the work that needs to be done. However, the greatest component that I can say then, as I'll say now, has always been the lack of realistic communication and bringing people to the table who it really affects, people like myself. I am not doing anything new when it comes to this work. This is just a new generation and a new face that's doing it. However, I say what we can do better. And when I say we, that means everyone. That means the government. That means researchers. That means policymakers. That means absolutely everyone who has anything to do with policy and making things just a little more clarified for everyone. Not those when you just get your statistics researchers, that you actually bring me to the table, or people who are at the front lines, who the medications may or may not work with, that you see us and not actually put so much emphasis and priority in paperwork. And that's what I believe has changed and continues to be an uplifting, necessary thing that we need to do. Thank you.
Grace, makes a lot of sense. I don't tell this story often, and I will be brief. It's your interview, not mine. I spent a long time doing NIH-funded research. It was incredibly rewarding. I knew a lot of and know a lot of colleagues that were incredibly helpful and great mentors to me. But it got to a point where I made a decision that to move the needle in a way that made sense to me, that I needed to partially walk away from that exceptional world and engage the community more directly. I know that's not exactly what you're saying, but I think it's embedded in what you're saying. Bring the actual frontline stakeholders to decision-making tables, both in terms of research and in terms of policy. I think that's an exceptional point, and needs to be articulated as you have. Tell us a little bit about your work as an LGBT liaison and health educator. What's some of the work you're doing these days?
Well, for the last 2 years, as we all have, we've all been somewhat having to restructure our programs, restructure how we do this work, because the work never stops, regardless where the world is right now. So the work that I do is that I speak to a community that usually is silenced, usually because of stigma, and also access. A lot of times, accessibility is not always available to everyone. It's always been a select few. And we're not going to get into pointing fingers. I know I'm not. I'm here to be a motivator for those of you all who really do want to see us go to the next level of how we deal with HIV and those who are affected with the criminal justice system. What I do is that we've been able to do things like, in the last 2 years, of virtual groups that we give here at the Osborne Association in the Bronx. We give virtual groups where I'm speaking to the community, people who are in shelters, people who are living in marginalized and limited situations, but they want to be educated. They want to know how to care for themselves. Something that I believe that a lot of times our established organizations and agencies are not always able, or are able to be equipped to do this work. And so what I do is that I go from any avenue of anything when it comes to health, when it comes to going to health fairs, when it comes to actually going to treatment centers, hospitals, speaking to any LGBT organization. because this work is interparamental regardless where I go and when I do it. So that is what I do.
So, Grace, let me ask you this, and this might be an outdated question because I'm so old. I remember being in lots of meetings on community-based outreach, community-based participatory research, et cetera, where at that time, the notion of truly reaching LGBT populations, particularly homeless, as you've alluded to, and those who've experienced trauma, was exceedingly difficult. It's not that you couldn't reach them at all. It was just, could you reach the widest group, particularly in urban settings where the numbers are significant, but can you really engage them? And can you develop a trusting relationship with them to facilitate, placement in education or job training or some other thing that hopefully will assist them, or after listening to what they say, what they're looking for. What's it like these days? Is it still a difficult, is LGBT population still difficult to reach because of stigma or fear? Have things gotten better? Have things gotten worse? How do we engage this important population?
Well, when we use the acronyms of LGBTQIA, I have a situation. I'm not going to say a disagreement, but I have a situation that, as a frontline worker, as a person who deals with the community straightforward, I want to always separate what has been done and what should be done and what can be more powerful to help the whole acronym. When it comes to those letters, lesbian, when it comes to that letter G, when it comes to that letter bisexual, when it comes to that letter queer, I believe, as most people won't say, but the information and the accessibility is there for, and the energy is there for those letters in the acronym. However, when it comes to trans and non-binary individuals, I cannot and I will not honestly sit here and say that there has been energy or even an ability to actually include us. I think people have become so comfortable with using the acronym as if the acronym is really what goes on. Let me be clear. When it comes to the letter T and non-conforming, we are never really contacted at the tables of decision making, policy thinking, or forming. Trans people always continue to be the back end of everything and the front line of all the information and getting. We're the ones out there in the street. We're the ones going to the treatment centers. We're the ones going to save ourselves as well as we should be. However, if there's one message that I want to be very clear here, let us separate the acronym letters here, because it's real comfortable for anyone to say the LGBTQ when they actually really need to be careful with that, because I'm here to tell you, as a trans advocate, as a trans health provider and service provider, I can tell you that the information is never, ever fair or balanced. I can gladly say and not feel any type of way about it, because it just is fact, is that when it comes to the lesbian community, when it comes to gay men and gay women, those letters in the acronym have all the information, have all the assets. They're at the table. Sometimes the table is them. A lot of times, trans individuals and people of really marginalized, and when I say really, the ones that maybe the LGBT are maybe not comfortable with accepting in the acronym and definitely distributing the information. So I say that at this genre in 2022, structure, focus should be the T and non-conforming, because the information is not being gathered because people have become comfortable with just saying the acronym as if it fairly distributes information or even services to the trans or non-binary. That's not true. So I wanted to get that on the table and let us focus on that, in my opinion. Thank you.
Grace, well said. The T and non-conforming. I mean, Grace, you say it with such eloquence and conviction. And of course, what you're saying makes complete sense. I mean, LGBT are four distinct populations. And forgive me if I summarize your point poorly, but the T is not being represented fully as you're describing it. It is and to just group the four populations together in acronym and then just assume, well, we've got it covered, we said all four letters, just doesn't make any sense. So we're going to take a quick break. When we come back, Grace is going to talk a little bit about her educational experience and how that set her up for the exceptional career that she has these days, advocating for LGBT and for trans populations. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
Built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
TV news, radio reports, and newspaper headlines in the 1970s and 80s misrepresented communities in the borough of the Bronx. Then, something transformative happened. By, for, and about the Bronx, BronxNet was born.
We are BronxNet!
BronxNet provides media education,
opening the doors to competitive careers in the media industry
for thousands of students in middle school,
high school,
and college.
BronxNet.
Media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So Grace, we always start this segment with the exact same question. Where were you born and what were some of your formative experiences?
Well, I was born in Detroit, Michigan. I came to New York in 1983 after having such a traumatic life, living there as an only child, coming to terms with not only my gender identity, but even expressing that and not even knowing that it was a way of freeing myself. Once I came to New York and I saw what the freedom in which I was looking for, I also became very adamant on my survival. I had a lot of I'd say roadblocks like incarceration and sex work and all those things to hinder me for a long period of time. But as time went on and I understood what my purpose was, my purpose basically was to take this status of being HIV positive, of not only as something that I have to save myself. Once I became very aware how I can save myself through following all the things that my doctors told me, I needed to go get myself really educated. And while incarcerated, I was able to attend Cayuga Community College and graduate. I was able to do all those certifications that while you're in custody. And I came home and I said, you know what, I want to inform a community that I don't see that's actually being addressed. I saw a lot of bias, and I don't think any of the bias was done in favor of malice. I just think it was the times of where we were as a nation and as a city. So today I'm a certified LGBT advocate. I am a trained HIV prevention analyst and advocate. I do this work not only to save my life, but to hopefully for those who are looking to do this. You just can't advocate. You have to go get some education. You have to be certified so you can be helpful and youthful and impactful to the community in which I say that I care about. So that is exactly what has been my story. I don't think that my story is unique anymore because I know that there are young people who are doing this work. There are agencies all over the Bronx that are doing this work. Destination Tomorrow, CK Life, Princess Janae Place, Fierce New York, Gay Men Health Crisis. Even though I'm going to give Gay Men Health Crisis their props because of their historical view, however, I have some concerns about these big organizations that consider what they've always considered, the marginalization of the T. They've always concerned themselves with the L, the G, and the B. So to bring something that's impactful to what I do, I had to be educated. And I continue to do so. So I just say that this work has and continues to be impactful for not only saving and helping my life, but I know as I walk these streets in the Bronx and I go to the city, which has now become very intrusive at moments, but I understand the fact of what I do. It affects people's lives, that I get stopped everywhere. It's almost like a celebrity status, but it's a celebrity status that actually has impact. So that's what I say about education and getting those things to be helpful with a community in which I'm trying to help, as well as myself. Thank you.
Yeah. So again, very clear and well stated that the passion of the advocacy benefits from the grounding in education. What led you, if this is not the right question, just let me know. So you got your community college degree when you were incarcerated. It must have been at least somewhat of a step to make that commitment. What led you to make that choice at that time?
Because, when you're incarcerated, the one thing that you have a lot of, and that is time. And I had those isolated moments where it wasn't about negativity because I knew that I would not be there forever. I was one of those, detainees or prisoners who knew that the outcome of their incarceration. I knew that I would be returning back to the community. And you had all these situations such as education and certifications and groups like PACE, which really means Prisoners for AIDS, Counseling and Education, that's in all the correctional facilities in New York State. And I jumped wholeheartedly in that, and that empowered me to get the information to be impactful for my community, but to first impact myself. Because one thing about advocacy, it can be real good to say those good talking points, but you have to be educated. You also have to be knowledgeable of how your suggestions can run in line with a researcher, how your ideas can run in line with policymakers, because not only is it affecting me, it's impacting the community in which I say I care about.
Makes a lot of sense. So let me ask you this. We just have a moment left. If you were to give one piece of advice to a young person in the Bronx or an urban setting or someone of any age in terms of how to move their career forward, what would that be?
It would be this. If you're standing on the corner, if you're standing in the office, if you are living offline or you're living however, first understand, as I had to understand, that I want to live. And once you realize how you can live healthy, informed, then you take that position. And you got to want to take that position, because this work is not for everyone. It becomes a passion. It becomes almost a statement to one's legacy for whatever you're living. So I would say to that young person, wherever you are, understand that whatever you're doing can be impactful, but how you start with yourself. You can't want for others if you don't want for yourself. So, because that is how I was able to impact myself, to impact others. So my statement to that young person, to that elder person, to that person returning to the community, to that person who's just recently been diagnosed, come to terms with how you're going to live your life, because there is life after HIV. There's life during HIV. Thank you.
Thank you, Grace. I want to thank Grace Detrevarah for joining us today. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America. See you next time. Until then, take care.